So mediastinum, in Latin, mediastinum means middle septum. See, this shaded area is the mediastinum. On the two sides of the mediastinum, there are the lungs and the pleural cavity. Okay. So the mediastinum is a broad central partition which separates the two laterally placed pleural cavities. The mediastinum is the median septum of the thoracic cavity between the two pleural cavities. See, this part is mediastinum. This is transverse section through the thorax. On the two sides, lungs and the pleural cavities are present. In the middle, here is the mediastinum. And this is longitudinal section, okay, or coronal section you can say. Coronal section through the thorax. On the two sides you can see the lungs along with the pleural cavity, and in the middle there is the mediastinum, this shaded area. So mediastinum is a broad central partition which separates the two laterally placed pleural cavities. Mediastinum is the median septum of the thoracic cavity between the two pleural cavities. It consists of all the viscera and structures of the thoracic cavity, that is heart and its great vessels, esophagus, trachea and principal bronchi, aorta, mediastinal lymph nodes, etc. except the lungs. And it is covered on either side by the mediastinal pleura. Okay. This part is the mediastinal pleura. So this is boundary of the mediastinum. Anterior boundary by sternum. See, this is rib cage. You can see the sternum. Here is the sternum forming anterior boundary. Posterior boundary is formed by the vertebral column, that is bodies of thoracic vertebra and intervening intervertebral discs. See, here are the thoracic vertebra, and in between the vertebral bodies there lies the intervertebral disc. Superiorly bounded by the thoracic inlet or superior thoracic aperture. Here is the thoracic inlet or superior thoracic aperture. Who is talking? Okay, so thoracic inlet is bounded in front by the manubrium sternum, on two sides by first rib, and posteriorly by the first thoracic vertebra. Inferiorly bounded by the diaphragm. See, this dome shaped structure is the diaphragm, and on each side lies the mediastinal pleura. So these are the boundaries of the mediastinum. Now what are the contents? Major contents are thymus, heart enclosed in the pericardial sac, major arteries and veins such as thoracic aorta and pulmonary trunk, trachea, esophagus, thoracic duct, neural structures such as different nerve trunks like sympathetic trunks, vagus nerves and phrenic nerve, and lymph nodes are there. Okay, so here you can see the structures along on the two sides of the vertebral body. This is sympathetic chain, splanchnic nerves. These are the azygos vein draining into the superior vena cava, two brachiocephalic veins joining to form the superior vena cava. This is phrenic nerve. This is vagus nerve. This is view from the right side. So here you can see the right phrenic, right vagus. This is lung root. Okay. And this is esophagus. In front of esophagus, here is the trachea. This is heart enclosed within the pericardium, and this is diaphragm, and this is view from the left side. Here you are getting, this is anterior aspect. Here you can see the sternum. These are the vertebral bodies. Here lies the sympathetic chain, and contents you can see the heart covered with the pericardium. Here is the lung root, and over the lung root arching structure. This is arch of aorta. Here is descending thoracic aorta. Posterior to the lung root, this yellow colored nerve is the left vagus. And anterior to the lung root, here is the left phrenic nerve. And here you can see the esophagus. In front of esophagus, here is trachea. And this small structure, this is thoracic duct. This is one lymphatic structure. Okay. And some lymph nodes you will also see mediastinal lymph nodes. So the divisions for the purpose of description and organization of structures, mediastinum is artificially divided into two parts. It is not actually divided parts in our body. Okay, for description we are dividing it. Superior mediastinum and the inferior mediastinum by an imaginary plane. This plane is known as transverse thoracic plane, passing through the sternal angle anteriorly. Here is the sternal angle, junction between the manubrium and body of the sternum. So transverse thoracic plane is dividing the mediastinum into superior and inferior mediastinum, and it is passing anteriorly through the sternal angle anteriorly and the lower border of body of 4 thoracic vertebra and intervertebral disc between T4 and T5 vertebra posteriorly. Here, this line, see, this is T1, T2, T3, T4. So lower border of T4, imaginary line passing through sternal angle anteriorly and lower border of T4 posteriorly. Okay, so this part above this plane is superior mediastinum and the part below it is the inferior mediastinum. Here is the transverse thoracic plane. So this part is superior mediastinum. Here is the inferior mediastinum. Okay. Next, the inferior mediastinum is further subdivided into three parts by the pericardium enclosing the heart. See, this is pericardium enclosing the heart. It is dividing the inferior mediastinum into three parts. Anterior to it lies the anterior mediastinum, posterior to it is the posterior mediastinum, and the heart and the pericardium included within the middle mediastinum. So these are the three divisions of the inferior mediastinum. Okay. So anterior mediastinum, the part in front of the pericardium, posterior mediastinum, the part behind the pericardium, middle mediastinum, the pericardium and its contents, that is heart and root of its great vessels. Okay. So this is the division of mediastinum. Mediastinum divided into superior and inferior. Inferior is again divided into three parts: anterior mediastinum, middle mediastinum and posterior mediastinum. Okay, so division is clear. Next we will discuss individual mediastinum and their contents. First, the superior mediastinum. Its boundaries are, see, this part is superior mediastinum bounded anteriorly by the manubrium sterni, posteriorly by bodies of T1 to T4 vertebra, on each side by the mediastinal pleura. Superiorly lies the plane of thoracic inlet, inferiorly imaginary line joining the sternal angle and lower border of T4 or transverse thoracic plane here. The superior mediastinum, okay. Now the contents of the superior mediastinum, see this dotted line is representing the transverse thoracic plane. So the structures lying above, these are the contents of the superior mediastinum. Okay. So see the contents, three muscles are there, sternohyoid, sternothyroid. These two are attached on the posterior aspect of manubrium sterni. Longus coli. Longus coli is attached to the vertebral body posteriorly. Thymus, this is present only in childhood and puberty. Veins. Veins are the superior vena cava, right and left brachiocephalic veins and left superior intercostal vein. See here, right and left brachiocephalic vein, these two are joined to form the superior vena cava and these are located in the superior mediastinum. And left superior intercostal vein, on the left side, first, second and third intercostal vein join to form the left superior intercostal vein. This is small vein, sometimes you can see during the dissection. Okay. So arteries are arch of aorta and its three branches: brachiocephalic trunk, left common carotid, left subclavian artery. See here, this is arch of aorta, ascending aorta forming the arch, then continuing downward as the descending thoracic aorta. Okay, arch of aorta beginning at T4 vertebral level and also ending at T4 vertebral level, beginning anteriorly and ending posteriorly, and its three branches you can see from right to left. These are the brachiocephalic trunk, left common carotid and left subclavian. Okay, and this brachiocephalic trunk on the right side, it is dividing into right common carotid and right subclavian. Okay, understood? So this arch of aorta and its three branches are included within the superior mediastinum. Other things are trachea and esophagus. Here this structure you can see with cartilage. This is trachea and it is dividing into two principal bronchi downward. Esophagus lies posterior to the trachea. Nerves are the vagus, phrenic, cardiac, left recurrent laryngeal nerve between trachea and esophagus. Okay. See here, these are the vagus nerves. Phrenic nerve is lying anterior to the lung root, and at the tracheoesophageal groove lies this left recurrent laryngeal nerve. Okay. It is hooking around the undersurface of this arch of aorta. See, this is a branch from this left vagus. Left vagus giving a branch, left recurrent laryngeal, which is hooking under the undersurface of this arch of aorta, then ascending upward between the tracheoesophageal groove. Okay, understood? Next structure is thoracic duct. Thoracic duct you have seen in previous picture, and lymph nodes are present. Brachiocephalic and tracheobronchial lymph nodes are present here in the mediastinum. See here, this is thymus gland. Okay, lying anteriorly. Different structures has been shown here. See, this is two brachiocephalic vein, right and left, and this is left superior intercostal vein which is draining into left brachiocephalic vein. These two brachiocephalic vein is joining to form the superior vena cava. Here you can see the arch of aorta and its three branches: brachiocephalic trunk, left common carotid, left subclavian. Here is the trachea, this is esophagus, this is right vagus, this is left vagus. You can see from the left vagus, this branch is known as left recurrent laryngeal nerve, hooking on the undersurface of this arch of aorta and then ascending upward at the tracheoesophageal groove. Okay, and here this is sagittal section through the thorax. You can see the sternum, then posterior to sternum, here lies the thymus gland, not present in adult. It is replaced by fatty tissue in adult. Heart and pericardium, ascending aorta, arch of aorta, descending aorta. This is left pulmonary artery, part of lung root. This is left principal bronchi. Here is the esophagus, trachea. Okay, this is inferior vena cava draining into the heart. Okay, left atrium, right atrium. Okay, so these structures you will see. Okay, so contents of the superior mediastinum from anterior to posterior, you can remember like this: my thymus loves baton. You can remember like the mnemonic. Muscles are the sternothyroid, sternohyoid. I is internal thoracic artery. It is lying in the anterior chest wall. Thymus gland is present. L is for lymphatics, lymphatic vessels. Thoracic duct and lymph nodes are present. Veins are the upper part of superior vena cava, left and right brachiocephalic vein, left superior intercostal vein. Arteries are arch of aorta and its three branches: brachiocephalic trunk, left common carotid, left subclavian. T is trachea with paratracheal and tracheobronchial lymph nodes. O is esophagus, N is for nerves. Nerves are the phrenic, vagus, cardiac nerves, left recurrent laryngeal nerve in the tracheoesophageal group. Okay, so these are the contents of the superior mediastinum. This is a transverse section through the superior mediastinum showing the arrangement of the contents. See, this is section through the sternum, manubrium sternum. Posterior, on its posterior aspect, these two muscles are attached, sternothyroid, sternohyoid. Then you can see the thymus. These are the veins, left and right brachiocephalic vein. These are the three branches of the aorta. On the right side, brachiocephalic trunk, left common carotid, left subclavian. See, these are the nerves, right and left phrenic nerve. These are the vagus nerve, right and left vagus nerve. From the vagus nerve, this left recurrent laryngeal nerve is lying in the tracheoesophageal groove, in between the trachea and esophagus. Trachea has C-shaped cartilage, and posteriorly the two ends of the cartilage is joined by the trachealis muscle. Okay, this is, and the cartilage is absent posteriorly for helping the distension of the esophagus during intake of food. And this is longus colli muscle attached over the vertebral body. On the two sides of the vertebral body, two sympathetic chains are present. Okay, and here is the vertebral canal, spinal cord will lie here, and these are the processes of the vertebra. This is spinous process, and these two are the transverse process. And these are the, on the two sides, mediastinal pleura, pleural cavity and lungs. Okay, and this is thoracic duct, section of, this is part of lymphatic tissue. Thoracic duct you cannot see very clearly, very fine structure. Rest of the thing you can see. Okay. So you practice a schematic diagram like this. Section through the superior mediastinum. Next we go to the anterior mediastinum. So superior mediastinum, its boundaries or contents we have covered. Next we go to inferior mediastinum. It has three divisions: anterior, middle and posterior. So anterior mediastinum boundaries: anterior boundary by the sternum, body of the sternum. Posterior boundary formed by the pericardium. And on each sides there is mediastinal pleura, and superiorly there is imaginary plane. This is imaginary plane. It is forming superior boundary, and inferior boundary is formed by the diaphragm. Contents of the superior mediastinum: thymus gland in children, which is replaced by fatty tissues in adults. Sternopericardial ligaments. Okay, this is connecting the sternum with the pericardium. Okay, so there are two sternopericardial ligaments, superior and inferior sternopericardial ligaments. There is internal thoracic artery and its branches. Its branches are the pericardioacophrenic and musculophrenic. It is dividing into two branches. Lymphatics and lymph nodes. All these are contents of the anterior mediastinum. See here, the contents of anterior mediastinum has been shown. See, this is thymus gland. Here thymus gland has been shown. These are the two sternopericardial ligaments connecting the pericardium with the sternum. Okay, and another thing is lymphatics and internal thoracic artery lying in the anterior chest wall. Next we go to middle mediastinum. This heart and its pericardium, this are included within the middle mediastinum. So it boundary anteriorly bounded by anterior mediastinum, posteriorly bounded by posterior mediastinum, superiorly bounded by superior mediastinum, and inferiorly there is the diaphragm. Okay, so this is the boundary of middle mediastinum. What are the content of middle mediastinum? Heart enclosed in the pericardium. Arteries are the ascending aorta, pulmonary trunk with its right and left branches. Veins are the superior vena cava, termination of azygos vein, pulmonary veins. These are the veins. Nerves are the phrenic nerve, deep cardiac plexus in front of bifurcation of the trachea. And tubes are the bifurcation of trachea with two principal bronchi, and lymph nodes are the tracheobronchial lymph nodes. So all these are content of the middle mediastinum. You can see here heart includes within pericardium, ascending aorta, pulmonary trunks, its right and left divisions, azygos vein draining into superior vena cava, four pulmonary veins. Okay, and here you can see the arch of azygos vein arching over the right bronchus, arch of aorta arching over the this left bronchi, and below the arch you can see this recurrent laryngeal ascending in the tracheoesophageal groove. This is thoracic duct. Okay, and this trachea and esophagus, this muscular tube is esophagus. These are included in posterior mediastinum, and these are the lymph nodes, tracheobronchial lymph nodes. Next we go to the posterior mediastinum. See, this green colored portion is the posterior mediastinum, posterior to the heart. So boundaries, anterior boundary is formed by the pericardium and its contents, bifurcation of the trachea and pulmonary vessels. These are the anterior boundary. Posterior boundary is formed by bodies of T5 to T12 vertebra and intervening intervertebral disc. Superior boundary by transverse thoracic plane and inferior boundary by the diaphragm, and on each side laterally there is mediastinal pleura. So this is the boundary of the posterior mediastinum. Now what are the contents of posterior mediastinum? Contents are esophagus. See, this is muscular tube, this is esophagus. Arteries are the কি হলো ঘুম পাচ্ছে সবার? Okay, so contents are the esophagus. Arteries are descending thoracic aorta. See, arch of aorta is downward from the level of T4 as the descending thoracic aorta and along with its branches. The posterior intercostal arteries are branched from this descending thoracic aorta. Next are the veins. Veins are the three veins are there: azygos vein on the right side and hemiazygos and accessory hemiazygos present on the left side. Okay. Nerves are the vagus nerve, sympathetic trunks and splanchnic nerves, thoracic duct and lymph nodes. Lymph nodes are the posterior mediastinal lymph nodes. So these are the content of the posterior mediastinum. See the contents. Here the heart with pericardium has been removed to show the structure in the posterior mediastinum. You can see the esophagus, the muscular tube is the esophagus, trachea dividing into two bronchi. Here is the descending thoracic aorta, azygos vein, thoracic duct, vagus nerve and sympathetic trunk. All these are contents of the posterior mediastinum. Here you can see descending thoracic aorta. Here is the muscular tube will be the esophagus. See here, this muscular tube is esophagus. This is trachea, descending thoracic aorta, left vagus, left recurrent laryngeal. Okay. Here also we can see esophagus, descending thoracic aorta, and see here azygos vein is present on the right side and accessory hemiazygos above and hemiazygos vein is below, present on the left side. These two are crossing at T7 and T8 level to join the azygos vein on the right side. Okay. So posterior intercostal veins are draining on the right side into this azygos vein, and on the left side they are draining into the accessory hemiazygos above and hemiazygos vein below. Okay, understood? This is thoracic duct. This is starting below from the cisterna chyli, ascending upward and draining at the left brachiocephalic vein. Okay, two veins, left internal jugular, left subclavian, is joining to form the left brachiocephalic vein. Okay, understood? And this is sympathetic chain, splanchnic nerves. This is phrenic nerve lying in front of the lung root. This part is the lung root. And this is superior vena cava. And you can see these veins. These are the posterior intercostal veins draining into the, this is left side because you can see the descending thoracic aorta. So here is presence of accessory hemiazygos above and hemiazygos vein below. Okay, and they will cross at T7, T8 level to drain into the azygos vein on the right side. Okay, so clinical aspect regarding mediastinum. So mediastinum can come as a short note, individual mediastinums. So if individually they can come, you can write down the boundaries and contents and schematic diagram whichever you practice. Okay, so clinical aspect is mediastinitis from infections of neck pass under the prevertebral fossa. The deep fossa of the neck have three layers. Okay, investing layer of deep cervical fossa, prevertebral layer and pretracheal layer. See here, this is prevertebral layer which is attached at the level of T4. This is pretracheal layer lying in front of trachea, and this is investing layer of deep cervical fossa. So from infection of neck pass under the prevertebral fossa reach till T4 only, not beyond it, as prevertebral fossa is attached here. So if the pus is formed from the vertebra, like in tuberculosis of the vertebra, spinal TB, so pus is extending up to T4 level because here the prevertebral layer is attached. And pass between the pretracheal and prevertebral layer, it seeps through the superior mediastinum to reach the posterior mediastinum. There is, it can freely pass here and in front of pretracheal fossa to the anterior mediastinum. If it lies, the pass can pass in front of pretracheal layer of the fossa, it enters into anterior mediastinum. And psoas sheath communicates with the posterior mediastinum. Psoas major is a muscle in the posterior wall of the abdomen. Okay, so in front of the psoas, so it is covered by deep fossal covering that is known as psoas sheath. So this psoas sheath communicates with the posterior mediastinum by a funnel shaped orifice. Therefore, pass from the posterior mediastinum can easily enter the psoas sheath and track down into the thigh in the region of femoral triangle. Okay, so from the neck, pass can extend through the posterior mediastinum through the psoas sheath up to the thigh region. Okay. So this is a lateral view X-ray. Okay, so this is transverse thoracic plane. Above it, this is superior mediastinum. Here is anterior mediastinum. This is posterior mediastinum. And you can see here the heart shadow. This is lying within middle mediastinum. And this is dome-shaped structure is the diaphragm. Okay, and this is fundal gas shadow of the stomach. Next is mediastinal syndrome. Compression of the mediastinal structures by any growth such as tumor or cyst will lead to mediastinal syndrome. Common causes are bronchogenic carcinoma, aneurysm of aorta, enlargement of mediastinal lymph nodes in Hodgkin's disease. Clinical feature: engorgement of the veins in the upper half of the body due to obstruction of superior vena cava. Dyspnea, that due to compression of trachea. Dysphagia due to compression of esophagus. Hoarseness of voice due to compression of left recurrent laryngeal nerve. Left recurrent laryngeal nerve is supplying the vocal cords, which is responsible for formation of voice. Okay, so if it is paralyzed, one vocal cord will be paralyzed, so there will be hoarseness of voice. Erosion of bodies of thoracic vertebra due to pressure on the vertebral column. So these will be the clinical features of mediastinal syndrome. Mediastinal syndrome can come as a short note. Okay, mediastinal syndrome. Next is mediastinal widening. It is caused by hemorrhage. This is important for your medicines also. In your final year medicine, these causes are asked very frequently in your x-rays or in clinics. So what are the causes of mediastinal widening, causes of mediastinal shifts? You have to see the palpate the trachea, whether it is shifted to right or left, and then you will be asked the causes of shift. So mediastinal widening causes are hemorrhage in the mediastinum from lacerated vessels following trauma. Example, head-on collision, massive enlargement of the mediastinal lymph nodes due to cancer of the lymphatic tissue, namely malignant lymphoma. These are the causes of mediastinal widening. An enlargement or hypertrophy of the heart due to congestive cardiac failure, if it is commonest cause of enlargement of the inferior mediastinum. Next is mediastinal shift. It is common in lung and pleural pathology, can be detected by palpating the trachea in the suprasternal notch. Here you have to palpate the trachea, okay, in the suprasternal notch. Shift to the, when it is shifted to the disease side and when it is shifted to the healthy side. It is shifted to the diseased or affected side due to an appreciable reduction in the lung volume and decrease in intrapleural pressure, as in collapse of the lung or atelectasis. Okay, if lung collapse occurred, then this trachea will shift to the disease side and shift to the healthy side due to intrapleural pressure is appreciably high on the affected side, as in pneumothorax or hydrothorax. Okay, see here pneumothorax has been shown. Okay, there is breach in the pleural cavity, air is entering from outside into the pleural cavity. Okay, so intrapleural pressure is high and this is leading to collapse of the lung and it is pushing the trachea to the healthy side. On this side the lung is healthy. Okay, so this is shift to the healthy side, occurs in pneumothorax or hydrothorax. Next is subcutaneous emphysema of the root of the neck in esophageal perforations caused by penetrating wounds. Air escapes into the connective tissue spaces of the mediastinum and may ascend beneath the fossa to the root of the neck, producing the subcutaneous emphysema. Next is potential dead space in the superior mediastinum. All the large veins, superior, this is important, this comes as explain why question. Okay, so potential dead space in the superior mediastinum, all the large veins, superior vena cava, right and left brachiocephalic veins, they are on the right side, and all the large arteries, arch of aorta and its 3 branches are in the left side. So during increased blood flow, large veins expand enormously while the large arteries do not expand at all. And this is because there is sufficient dead space on the right side, and it is into this space that tumors of the mediastinum tend to project. Okay, so tumors of the mediastinum tend to project towards the right side because right sides there are spaces for expansion of these veins. It cannot extend to the left side because there are large arteries are present and arteries are not that much compressible. Okay, so that's why any tumor in the mediastinum tend to project towards the right side. This comes as a explain why question. Why any tumor of mediastinum tend to project towards the right side.